So Medicaid and Medicare, they're making cuts, they're making changes, and it is affecting people in real time. But the people that it is affected is the people that, you know, you wouldn't think twice about because you neglected them yourself within your own family. It affects our elderly community. I was raised by my grandmother and a neighbor, okay? And then I also worked within nursing facilities. So elderly people are really close to me, and I can tell you that they are the number one neglected, okay? They are neglected. We forget, Americans forget about the elderly. We work and we do all of this stuff and to build up societies, and then society forgets about us when we are old. America is the number one place where we do not value family in the ways that other cultures value their families. America is filled with nursing homes where once your family member can no longer take care of themselves, instead of you taking care of them like other cultures, they put them in nursing homes where they do not get the best food, nutrition, and the best care. Like, I've worked in these facilities, so I can tell you it's not where you want to be when you're old, okay? Especially if your family doesn't come to check on you. So now people are being kicked out of these nursing homes. Procedures aren't being properly given. Medication isn't getting got. So, and yeah, I said getting got. It's like, it's not even a question of what can we do. It's a question of, are you prepared to do better by your family? Are you prepared? Are we mentally prepared to understand the assignment of generations and looking at other cultures and seeing how the Asians take care of their elderly? Everybody takes care of their elderly but us, but white and black people. Like, not even being funny, let's put this shit on the table. Everybody takes care of their elderly but white people and black people. And I'm going to more really say white people, because black people, we've been kind of like, our grandparents was taking care of us. Where we going? And you know, when I tell you, when I'm in those nursing homes, it's a little bit of black people in there. A little sprinkle bit. Okay? Because we can't afford that shit. Sometimes even with the Medicaid, we can't afford it. So now that they are being kicked out of these nursing homes, because, you know, it's the homeless and the elderly. We got to get them out the way first, right? The government, right? We got to get the homeless and the elderly. Those are the easy targets. They're going for what's easy first. Okay? And if you think that you're safe, like, they're going for what's easy first, and then they're going to go and their pickings. The middle class is next. So now, are we prepared to have our homes where our parents are living with us? We are taking care of our parents. You might have to hire a caregiver. Where are you going to pay for it? Where are you going to afford that caregiver? It's not cheap, y'all. It is not cheap. It's not cheap. Our grandparents were able to work jobs that took care of them, even in their retirement. We don't have that. So now we got to begin putting our brains together, because a new world is forming in front of us. Literally, while we're typing and talking, the world is forming and changing before our eyes. And we have to be able to change with it. It's not about what happens, but how you respond to it. So what is going to be our solution to combat this?
Hello, brothers and sisters. Welcome back to the channel. And I'm hoping that you are doing great from wherever you're watching me from. I'm your host and presenter, Jindok Stories, and welcome back to the channel. It's been a while, but we have to discuss about all these important things that I feel like some people need to be reminded about these issues. Remember today, there is a question on the elderly people of the United States. Remember, majority of Nebraska, all these suburbs, majority of the population in these places are being occupied by the elderly, mainly conservatives who want to store the American culture, per se, presumingly, right? But now, there is an important information. Remember, under the big bill that Mr. Donald Trump was about to deal with, amongst things of discussion was the Medicare and Medicaid. And majority of things that people don't know is that the Medicaid and Medicare is not only for the poor people. but it's also for the elderly of the United States. This has been so much important to the elderly of the United States. And this is why it becomes diabolic, because you realize that it is these old people that voted for Mr. Donald Trump. And you understand really how the American society is, especially when you talk about the elderly. There's an article that I read some months ago. It talked about how it's so challenging having elderly people in the United States, because many of them, not all of them, but many of them are not being taken care of, right? Because when it reaches a certain age, people want to take care of the elderly. But I'm not saying that I'm not saying every American is trying to do this, but majority of the people that are having this elderly are not giving them the right care. To add on top of that, something worse is that the people that voted for Mr. Donald Trump, it means that they voted against Medicare and Medicaid. And amongst all these things, these are the things that benefited these elderly, especially white elderly. Historical roots of American approach to elder care. This is an important topic that we need to talk about, that we need to address. The United States has always had a complicated relationship with the welfare of its elderly citizens. While Social Security, created during Franklin D. Roosevelt's New Deal era in 1935, was intended to provide a safety net for retirees, it was never designed to cover medical expenses. The gap eventually led to the creation of Medicare and Medicaid in the 1960s under the President Lyndon B. Johnson. Right. Now, Medicaid, although originally aimed at low-income individuals of all ages, became especially crucial for elderly Americans who required long-term care, something Medicare does not adequately cover. From the very beginning, elder care in the US has been fragmented, with gaps in coverage forcing many seniors to rely heavily on Medicaid to survive once they exhaust their savings. But what is happening to the Medicaid? Join this great discussion and let's talk about it. I'm your host and presenter, Tech Stories. If you're watching us for the first time, I'm going to be asking you to please subscribe to the channel, join our membership, and really get to see what I can offer you. But until then, let's get into it. I'll be back.
Because it's happening. And instead of us being upset that it's happening, we should be finding ways to conform to what is happening that works for us and not what they tell us should work for us.
Yep. Them nursing homes finna not take Medicaid, so y'all better get them rooms ready for Mima and Papa. Yeah, combine them kids' room. Get rid of the den, man cave, whatever y'all got, scoot it over, because Mima and Papa is coming to the crib. I don't want to hear nothing. This is not what I voted for. Yes, this is absolutely what you voted for. Okay? No, I don't want to hear any of that. Mima and Papa will be at the crib in 30 to 45 days. All right? Yeah. Yeah. That's where we are. And listen, before you get in my comments with that red, blue, left, right, I don't want to hear none of that, bro. You can put that Trump hat and that shirt on your Mimo and Papa, but they coming to the crib. You can best believe that. If your in-laws use Medicaid, a lot of these services are going to not accept Medicaid. So yeah, make room.
So listen, I was sick and I was lying in my bed, and then I was scrolling here on this TikTok streets, and I'm seeing a whole bunch of videos of people getting letters from the nursing home that their father is going to have to leave because they are no longer accepting the Medicaid portion. The Medicaid portion that actually allows them to keep them in the nursing home. Usually Medicaid waiver. A Medicaid waiver that takes care of them being there. You guys don't understand how this works. I told you that the elderly and the disabled population are going to be affected. And this is the way that the Trump administration is going to do it, because they don't care about you. We told you time and time again that they don't care about you. Maybe this time you will listen, but we don't know. You guys were thinking about the Epstein files, and now you're not. Now you're not. But I want to tell you how this affects you because, yeah, your parents are not going to get the care, especially if they're medically needing. What about if they're trached? What about if they're intubated? What are you going to do then? That means you're going to have to pay out of pocket to care for them. And some of the states, you are actually, the responsibility lies on the children, and they can go after you if you don't take care of your parent. I'm not sure if your state qualifies, but I'm damn sure going to make the next video about the states that actually make this a law or find you. So let's think about a disabled kid, right? That has all these medical needs, could be trached or whatever, and now the child is 18. God forbid something happens to the parents. Who's going to take care of this child? Because that Medicaid waiver is not there. It has always been a safety net. Always been a safety net for children that are disabled, mentally incapacitated, and of course, medical issues. And yet, we're taking this away. And you guys are like, well, not all of it is taken away. What states are going to fund this? Are they going to have the adequate money to take care of these individuals? There's going to be a lot of homeless people in the street. Lots of homeless people. There's going to be lots of families struggling every day. This is something else that you have to contemplate and think about. Shit. Not only is my coffee high, not only is my groceries high, now I got to take care of my father, which I have to pay someone $25 an hour to be in the home caring for them. And then when I come from work, I have to care for my father after that because I'm trying to save money. I'm trying to save money. This is a real issue, and I don't understand why you don't get it through your head that Trump was the worst thing that happened to us. The worst thing. You didn't learn the first time, and you damn sure ain't learning now. Maybe this time you will learn this lesson. Anyway, you guys have a blessed day.
Okay, now let me tell you what I really want to talk about today. I think that this will be an amazing resource for the Black community. I do, and I hope it works out well for us. Anyway, listen. The big beautiful bill is having a consequence that for some reason people didn't see coming. People thought that when they cut Medicaid that it was going to affect just Black and brown little childrens. You know, I did this TikTok about 2 years ago. And in the TikTok, I was saying, look, y'all need to watch out for y'all elderly people because they out here, they can't drive. I'm seeing them in the grocery stores. They struggling. They having a real hard time. And for whatever reason, what I said in that video really struck a chord with white people. Got to the point where I lost complete control of the post and I just let them have it. White people took over that post and they started telling their horror stories about why it is they don't fuck with their people no more. Meaning their grandmas and grandpas that I'm seeing out there that need all of this help. Because in the Black community, one thing you gotta say about the Black community is that we tend to take care of our elderly. We tend to be more in community in that way. Not all of us, but collectively speaking, for the most part, yeah. We take care of our mamas and grandmamas and whatnot. And you don't really too much see them in nursing homes. You know where I'm going with this, right? So they just told story after story after story after story. And as long as they weren't racist, I just let it stand. And meanwhile, the Black people, we just kind of sat back and we just kind of listened to these stories. Well, these are the same people, you know, because you always want to say, you know, these are the same people now that are doing all these videos about how they work. They have stuck their relatives in homes. And now because of this big, beautiful bill, all these nursing homes are calling these people up because that big, beautiful bill goes into effect in February. That's when these Medicaid cuts start to happen. Sometimes I get Medicare and Medicaid confused. I mean to say Medicaid. And remember, there were Black people not too long ago, just last month, that were trying to inform people that didn't think they had Medicaid, that they in fact had Medicaid. It just wasn't called Medicaid. It was called something else. Like here in South Carolina, I believe it's called Healthy Connections or Healthy Care Connect or something along those lines.
And that's in fact Medicaid. It's just not called Medicaid. You know, like how some people thought that they had the Affordable Care Act, but they actually had Obamacare. I don't have Obamacare. I have the Affordable Care Act. Remember? That's these same kinds of white people, y'all, that I'm talking about, that didn't realize that they had Medicaid. And they, in fact, have Medicaid. It's just called something else. Well, they're getting all these phone calls from the care facilities that they have stuck their elderly people in, and their mamas and their meemaws and shit, and they're saying, you're going to have to come and find some place, come and pick up your people and all of their shit and find some place else for them to go because of the big beautiful bill. This facility will no longer take Medicaid patients. Talk about fucking around and finding out. These people voted for this. You say, how do you vote for that? Yeah, you did. If you voted for Donald Trump, third party, or not at all, you voted for this. You 100% did. You voted for this. You know how at the end of my videos when I said if you cannot help, at least don't hurt? I try to put that into people's minds so that people can think outside of themselves, get acclimated with thinking outside of ourselves, because the world doesn't revolve around us. There are other people to consider, other people to think about. When I cast my vote, I voted for everyone. Everyone. And some people only voted in the best interest of themselves. Well, apparently they didn't even do that, because they work and now they have to find care accommodations for their people. And let me tell you, being a caretaker, a care provider ain't easy. It's not easy. Some of those people need round-the-clock care, around the clock. Somebody gonna have to quit their job to stay home with me, Mom. The person who signed them in is the person that's responsible. Buckle up, Buttercup. We just in the beginning stages of how your vote has destroyed or is destroying this nation. This is one of those things that I'm not saying that black people won't be affected, because not, again, like I said, not a lot of us tend to stick our people into care facilities. First off, we can't afford it. First off, most of us just can't afford that. And then secondly, like I said earlier, most of us tend to keep our mamas and grandmamas and them at home. Somebody checks in. Somebody takes care. Even if the family got to take turns dividing up the responsibility for their care, we figure it out. And this is another example how elections have consequences. And while I do not celebrate this, because it's sad all around, this is what happens when a nation's education is defunded and people can no longer think outside of themselves and or critically, can't see the forest through the trees, can't think on down the line, can't think about what tomorrow is going to bring as a consequence, a result of this vote. And they thought it was going to affect all these other people, and here they are. Their farms are fucked up, and now they got to deal with their old honorary ass daddies and granddaddies and shit. Elections have consequences. This is just the beginning. This man has not been the president for a whole year yet. And look at how they are tearing down this nation. The poor will get poorer and the rich will get richer as long as this administration is in office. And that's just the truth. With that being said, do something nice for someone today. Get yourself in the habit of thinking outside of yourself. There are others to consider, not just you. If you cannot help, don't harm. Be righteous. Have a righteous day. And if you would like to donate to the library pantry or to this platform or just buy me a cup of coffee, I would certainly appreciate it. I'll leave my Cash App and Venmo down in the comments along with the link to the room. Y'all have a good day.
Hey, y'all, just coming through real quick. Listen, have y'all heard or saw the video of the young lady saying that her father is in a nursing home under Medicaid? And the nursing home is saying that he has to September the 15th to find somewhere to go because they're going to do away with the Medicaid. We know that 65% of individuals in nursing homes, y'all, are covered under Medicaid. So this may result in individuals having to go back home to their families to take care of them at the level that the nursing home will be doing it, okay? You'll have to do that at home yourself, probably, or hire somebody if you can afford it, okay? Or the nursing home may shut all the way down. Some of them may put all the people on Medicaid out and privatize it and just private pay. So, y'all, that was something to think about when they went out and voted for what they voted for. What do you all think about that? Do you have family that's in a nursing home that may have to be put out or leave or go home? Let me know. Comment, share, and follow me.
In a previous video, I talked about the so-called Big Beautiful Bill that reshaped how nursing homes operate and how instead of increasing quality, it drove up administrative burden and corporate control while care staff continue to dwindle. But there's another layer to the staffing crisis no one wants to admit: immigration policy. Under this new administration, key visa programs that once allowed foreign-born workers to fill critical roles in healthcare, especially in long-term care, were quietly restricted or allowed to expire. That includes programs like the H1TE for nurses and reductions in employment-based visas and refugee admissions that historically helped staff these roles. For many facilities, immigrant workers weren't supplemental, they were essential. Immigrants make up nearly a quarter of the direct care workforce in the United States. In some regions, they are the majority. They're the ones helping residents bathe, eat, transfer safely, and manage chronic conditions. These aren't jobs people are lining up for domestically. They're hard, often underpaid, and carry little prestige, yet they're foundational to elder.
Hello, brothers and sisters. Welcome and welcome again back to the channel. I feel like these are the most important things that we need to address. And I really find it so important because when people are voting for Mr. Donald Trump, people are not trying to see the magnitude of the decisions that they made. But I believe that it is right now that this is making sense to them because they made a mistake. But right now, it's really, really making sense to them. It's making sense to them for them knowing the place of Medicare and Medicaid. Initially, people thought that it was only for the poor people. But remember, as I said earlier, the United States has an history when it comes to taking care of the elderly. Medicaid is a lifeline for the elderly, and this is something that people need to understand. Contrary to common misconception, Medicaid is not just for the unemployed or working age poor. A large portion of its budget goes towards elderly Americans, particularly those in nursing homes or requiring in-home health services. These are expensive services. Private nursing home care can cost for around $8,000 to to 10,000 bucks in a month in many states. Now, without Medicaid, millions of seniors will have no way to pay for such care, leading to family bankruptcies or neglect. Medicaid covers over 60% of all nursing home residents in the United States. Removing or restricting this coverage would instantly throw elderly care into a crisis. Adding on top of that, there's been a crisis by the elderly. I saw a documentary, I read some articles about this, and if people don't check on this, honestly, it's going to get crazier. It's going to get crazy and crazy and crazy and crazy. Because these are things that we need to talk about. And I feel like it is time the people that made their own decisions are looking into it, into another perspective. Especially those who are affected are people who now has to cut their check to cover for the elderly. And this simply means that this is something that they could have avoided by, just making the right decision. And this shows you our racism is so much expensive. And it affects everyone in different angles. If you think that you're not poor, and now you're having an elderly person that you need to take care of, maybe they are your grandparents, maybe they are your dad, or they are your mom and they are already, seniors, that really has an implication towards your check. All right? It means that the amount of money that could have been used to do something else, you will need to cover to, take care of other things that should have really helped, right? And I'm not saying that helping the elderly is wrong, but the government had catered for this majority. But people came and ruined it for themselves. Now, the elderly are vulnerable to policy changes. This is one thing that people need to know. The elderly are uniquely vulnerable when safety nets programs are revoked because they cannot simply re-enter the workforce to earn more income. Unlike younger individuals, they cannot adapt to sudden financial shocks through unemployment or reskilling. A revocation of Medicaid would leave them with two devastating choices. Either they will rely entirely on already strained family members for care or go without the care they need, risking severe health deterioration and early death. This is not just an economic issue. It is a direct threat to the survival, right? It is a direct threat to the survival of the elderly. And I think this is really important and people need to see it in that sense. Or else, I don't really know, but I really feel like this is important for us to have discussed. Probably you are having an elderly person back at home. What can you say about this? The Medicare and the Medicaid. How is this going to be happening? Right? Talking about the role of families and the burden of caregivers as also another challenge. When the government withdraws support, the responsibility for elder care shifts heavily to families. Often, adult children who are already struggling with their own expenses, debts, and child rearing costs. Without Medicaid, these families will face crushing financial burdens, potentially leading to a phenomenon of caregiver burnout. In some cases, adult children will have to quit their jobs to provide care, resulting in lost income and even homelessness. This intergenerational stress not only affects the elderly, but it destabilizes the entire family unit. And this is what a majority of white Americans made this mistake for choosing Mr. Donald Trump, because you get to understand the other side of the coin. And how does it really make sense to you? I think that it really, really makes sense right now. talking about the social consequences of revocation of Medicaid. If Medicaid is revoked or drastically cut, we can expect an increase in elder neglect and abuse cases. Overwhelmed families and underfunded institutions often cannot meet the needs of their seniors, leading to unsafe living conditions, malnutrition, and untreated illness. Social isolation, already a significant issue among elderly Americans. These will deepen with seniors becoming confined to inadequate home settings without access to necessary health professionals. The moral stain on a nation that abandons its elderly will be profound, echoing through the future generations. Right. This will also lead to the economic fallout on communities. Medicaid does more than just help the individuals. It sustains entire local economies. Nursing homes, assisted living families, and home health agency employ millions of workers, many of whom are women and minorities. If Medicaid funding disappears, then these institutions will close or downsize, resulting in job losses that ripple across communities. Rural areas will be in particularly hard since they already face a shortage of healthcare facilities. The disappearance of these jobs will further hollow out struggle towns and small cities. Right? Getting to understand the political dimension and public backlash that is going on, especially to the Trump supporters. The political dimension truly cannot be ignored because many Americans, including a significant number of white working class voters who have historically supported political promisings to shrink government, are now waking up to the fact that Medicaid cuts will directly hurt them. The revocation of Medicaid will create a political backlash. As these voters realize the contradiction between political rhetoric about personal responsibility and the reality of abandoning elderly citizens who have already paid into the system their whole lives. This is a case where ideology collides with the practical needs of real family. America has a pattern of neglecting the elderly, and let's talk about it. Historically, the US has not viewed elder care as shared social responsibility in the same way many European nations do. Countries such as Sweden, Norway, Germany have robust public elder care systems, recognizing that aging is a universal stage of life requiring support. In America, however, elder care has been treated as a private matter, often left to families to solve their own. The Medicaid program, though imperfect, was one of the few exemptions, a public acknowledgement that society has a duty to its seniors. Revoking it will return to the darker past of institutional neglect. I would like to talk about the illusion of self-reliance in old age. American political culture often emphasizes that often romanticize the idea that self-reliance, that people should plan and save for their retirement and medical needs without depending on government programs. But the reality is that medical costs in old age are unpredictable, and oftentimes it can be catastrophic. Even middle-class families with savings can be bankrupted by a few years of long-term care. The revocation of Medicaid will expose this myth, leaving even disciplined savers unprotected from medical ruin. In other words, No amount of personal responsibility can shield against the high cost of aging in America. Right. So, really, let me know what you think about this video. I really want us to have a clear discussion about this. So tell me about this, what you think about it in the comment section. And I'll still remind you that if you're watching us for the first time, again, I'm going to be asking you to please subscribe to the channel. On my way to 150k subs, but I'm asking you to please help me reach 150k subs by sharing my video to other people so that the algorithm might share it to people who are like-minded like you. So again, I'm saying thank you for the support, family. Until then, let me see you in my next video. Peace, love, and harmony. Salute.